Hello everyone, I am Dr Mrunal Godse. I'm a root canal specialist and endodontist. Gum bleeding is a very common problem. Most commonly, the reason behind gum bleeding is plaque. Plaque is nothing but food that gets accumulated around our teeth, especially our gum line, and they cause a lot of inflammation in the gums if not removed at a particular time. Within about 24 hours, if that plaque is not removed, they inflame the gums and therefore the bleeding happens. This is the most common cause of bleeding gums. There can be other causes as well, wherein there is an hormonal imbalance or hormonal fluctuations, especially in pregnancy. There could be vitamin C or K deficiencies. There could be some injury or the brushing habit, which is slightly more aggressive, which can cause injury to the gums, and therefore we can have bleeding gums. There could be some medications because of which the gums may bleed. So depending on what the cause is, the gums bleed accordingly. So the most common cause, that is the plaque, the remedy or the solution to it is quite simple if it has not progressed. So if whether it is serious or not, if it has been taken care of at an early stage, then yes, it is not a serious problem. But if aggravated, it can go a little beyond. Say maybe then we maybe a tooth loss or something of that sort. Dental Association normally recommends is twice annually. So every 6 months you're supposed to see a dentist. Now this is a thumb rule which generally people follow, but that can vary from a person to person. So if at all there is a person whose oral hygiene is excellent, who is not really predisposed to gum diseases or cavities, the patients who do not have as much of dental problems can make it to around a year or every year or so. That could be their time interval when they visit a dentist. But then again, there are people wherein they have bleeding gums, they have tooth decay, which is more common. In such patients, it is better to visit the dentist every 6 monthly or even every 3 monthly, so that what happens is that like very small problems can be taken care of at a very early stage. So any red flags which can be seen by the dentist, they can be attended to then and there, and the solution will be a little more better than it would be if the disease progresses to an advanced stage. Whenever we eat food, the food kind of makes a film over our teeth, and especially near our gum lines, and this is what is plaque. So plaque is a sticky substance which basically is food debris. The problem with plaque is that if at all it is not removed or it is not taken care of, or it remains undisturbed for more than 24 hours, it starts becoming a problem. So it starts growing bacteria inside it. If not taken care of in 48 hours, then eventually it gets hardened, and then something called as tartar or calculus is developed. This tartar, furthermore, it is kind of a hard structure around your gum lines. It is again a more detrimental cause for your gum diseases, wherein your gums, your bone, everything gets affected. Bone basically supports your teeth. So the bone, if at all it gets affected because of this plaque or tartar, the tooth becomes weak and eventually there'll be tooth loss. So plaque, though, is a naturally occurring process in our teeth, we should be able to make sure that that plaque is taken care of, or it is disturbed, or it is dislodged before it actually becomes a problem to our oral cavity and our teeth. Also, there are bacteria which are present inside our mouth. These bacteria start acting on this plaque, which is stuck in between our teeth, and then causing acid formation. This acid eventually leads to enamel loss. So subsequently, tooth decay. So plaque basically is the reason of tooth decay or gum disease, which is the most common cause of oral problems. Different types of treatments are given for gum bleeding. Depending on what the cause is, normally we treat according to the causative factor of the bleeding gums. As I said, the most common cause is plaque. So, thorough cleaning, a professional cleaning, which is called as scaling, wherein we use an ultrasonic instrument so that we clean the plaque and the tartar which is present in between teeth. If that is done around every 6 months, then most of our gum diseases will be taken care of at a very early stage. That is done professionally, but on your own, if a good oral hygiene is maintained, it can we can actually prevent gum bleeding. So even though your gums have started bleeding, you practice your oral hygiene measures well, start brushing well, start flossing well, and the bleeding gums can automatically come down. The bleeding will automatically stop. If at all, apart from your plaque, if your oral hygiene is good and still you have bleeding gums, then maybe vitamin C and vitamin K deficiency can cause such kind of bleeding. Depending on what the cause is, we can take care of the bleeding gums. For us to keep our gums healthy, it is very necessary that we practice oral hygiene measures well. Oral hygiene measures include, firstly, proper brushing. So, brushing adequately and the right way. There is a particular way in which you should brush your teeth so that you are sure of dislodging the plaque and the food which is getting accumulated around your teeth. Brushing, then secondly, you have to make sure that there is the food which gets brushing only removes the food on the surfaces of the teeth. The food which gets stuck in between the teeth, the brush is not able to reach that. So flossing is something which we really advocate. We advise our patients to take up flossing very regularly, so that this kind of debris and this kind of plaque, which is again a causative factor for a lot of oral problems, is taken care of at the start point. I would advise proper brushing, proper cleaning, and flossing to start with for preventing any gum disease. Healthy diet is something which will avoid any kind of vitamin deficiencies. So healthy diet will be another way of preventing it. Making sure that whenever you have carbohydrates are very easy to break down. So whenever we eat carbohydrates or any sticky substance, it kind of remains on our teeth. So apart from brushing, if we follow rinsing each and every time we have something, we can reduce the amount of gum disease. Brushing is the most important aspect of oral hygiene. That is how you maintain your oral hygiene. Brushing in a correct way is equally important as much as actually brushing is. So the first thing before starting brushing is selection of a good toothbrush. So a toothbrush should be such wherein firstly the head of the toothbrush should be such. It should not be very bulky. It should be according to your mouth, wherein it can reach the difficult areas in your mouth. So it should be slightly slender, and it should be able to reach those difficult sides in your mouth. Secondly, the bristles of the brush should be normally should be soft. Instead of hard or medium bristles, I would recommend soft bristles, wherein they're not very harsh on the enamel, neither are they very harsh on your gums. So a soft bristle, slender head toothbrush is what ideally should be taken care of. Once you have the brush, there is a special technique wherein you make sure that the food and the debris which is collected right around your teeth is taken care of. The first thing to start with is you have to keep your brush angled at about 45 degrees to your teeth, if it can be seen like this. So it should be at 45 degrees at your teeth. And you have to start from the gum line and move towards the lower part of the tooth. So if you're brushing your upper teeth, it has to go something like 45 degrees like this, and you have to go down. So these are the strokes which need to come. These are gentle strokes. So gentle brushing is very important so that you preserve your enamel and not hurt your gums. So this is the first step. You have to start from the outer surfaces and come onto the inner surfaces of the teeth. So these are the outer surfaces of the teeth, but the inner surfaces of the teeth also need to be cleaned. So you have to angle the brush such in a way that you'll be able to clean your inner surfaces as well. Especially in your front teeth, it becomes difficult. So you can just vertically invert the toothbrush and make sure that your under the inner parts of the teeth are also cleaned well. Outer, then inner, and lastly, you have to clean the surfaces on top of your teeth where you actually eat, where the food gets stuck. So the chewing surface of the teeth also needs to be cleaned. You can divide the teeth in three parts: right, left, and center, so that you will be able to make sure that you are giving justice to all the areas. The trick for how much time to brush, how many times to brush, and how long to brush is you have to brush 2 into 2. So it's like twice a day for 2 minutes. You can have a clock set for 2 minutes so as to make sure that those 2 minutes are really given for your brushing. Following brushing, it is necessary that you floss. So floss is nothing but a thread-like structure which which can go in between your teeth, and you can remove the food in between them. Flossing is slightly tedious than brushing, and we are not very used to it. So there is a new replacement of floss, which is called as oral irrigator. So oral irrigator is nothing but a sort of device which has a jet of water. It has a forceful jet of water which comes through the through its pipe and make sure that the food is getting dislodged in between your teeth.